The views and opinions expressed on the Healthcare Advocate Show do not necessarily represent the views and opinions of Connoisseur Media or its advertisers.
Revolution Healthcare Radio is brought to you by Home Helpers of Connecticut, in-home senior care services, and Protein Sciences, the creators of Flu Block, a safer, more effective flu shot.
It's Revolution Healthcare, the show that keeps you in the know about the ever-changing healthcare system. We all need answers to our many questions about health and the revolution in healthcare. Presented by Patient Advocate for You, making sure that your healthcare is coordinated properly. And now, here's Sharon Gauthier, taking your calls and sharing information. 1-888-574-2723. 1-888-574-2723.
Good morning, everybody. Welcome to Revolution Healthcare Radio. This is Sharon Gauthier. I'm a registered nurse, and we have a care management company. We're very excited today. In a little bit, we will have Chris Fey, who's nationally known. He's a longtime healthcare entrepreneur. Mr. Fey was founder of Healthcare USA, M Health Ventures, U.S. Preventive Medicine. He's also a member of the Wall Street Journal CEO Council. Presently, he has a company called BigBang Health Care, which is really involved with self-funded healthcare products, I guess. The self-funded, a lot of people don't know what self-funded is, but it tends to be a place that a lot of companies are going to. So rather than have your traditional Blue Cross, Connecticut, United Healthcare policy that you would go in and sign up for with your company actually has the ability to self-fund their healthcare benefit. It really was, traditionally it's been with a lot of unions where they had their self-funded programs set up, and it is the company that puts in a certain amount of money into a fund, and then each employee contributes to that fund, just like you would if you were paying for your own insurance working with a company. At that point, what would happen is they then assign an administrator to that fund. So that administrator would oversee the fund, and you as an employee, if you have to go into the hospital in order to have a surgery done, then there is usually normally a third-party person. I actually have a friend of mine, Deborah Alt, who has a company like this out in Michigan, who's a registered nurse. That third-party company would then be the one to find the best price, the best costs related to that surgery, the best hospital, and then help with organizing your care through that process. It was always interesting to me, and I once had a reporter ask me why it is that someone, when you go to the hospital, you can't look at a list. Like if you go to St. Francis, Hartford, New Britain Hospital, and you say to them, can I have a list of what the cost is for a hip replacement? You're not going to find that. If you ask your doctor, can you tell me what the cost of a hip replacement is? Maybe they'll give you a range. But the reason for that is whatever your insurance pays is what the cost of it's going to be. I'm not quite sure why they do that. Sometimes I think they figure that if it's a larger amount that you're paying because your insurance company will pay that larger amount, it covers the people who are uninsured. But that's kind of how it goes. So for myself, I have wonderful coverage, Blue Cross. My husband worked for the state of Connecticut. And whatever the state of Connecticut's Blue Cross will pay for a hip replacement is what my charge will be. It wouldn't matter whether or not the actual charge was $15,000 or $20,000. If my policy paid $50,000, they're going to charge $50,000 for that. I never thought that was a great way of approaching it, but that's what we're looking at in today's world. It's whatever your insurance will pay. If you're self-paying, it becomes somewhat more negotiable, or maybe the cost is even more than the actual cost would be if they charged your insurance company. I'm not quite sure how that works. If there are any insurance gurus out there, they're welcome to call the show and explain some of that to us. Our number is 888-574-2723. If you call for any if you'd like to call with any stories or any questions. The reason why we started the show, of course, was to discuss things that people may not know about, like self-funded programs, and also talk about the stories, which we've brought many of you, many stories to you, and we've had some of our callers call in with some stories. I'd like to say hello to Dot. She's one of our faithful listeners. Hi, Dot. Hope you had a good Thanksgiving. Did we have a call on? Oh, you didn't. So we'll shortly be talking to Chris Fey, who is the CEO of BigBang Health Care. Kind of difficult to explain. So he's coming on the show in about 10 minutes, and I wanted to discuss a little bit of what my week was like this week. So we have a couple of clients that are living independently right now in an independent setting. It's an elderly care community, and this particular gentleman has been there for probably about 4 years right now. He's a widower, and he's had his daughter-in-law and two daughter-in-laws that have been involved with him. He's done pretty well up until the last couple of months, and we've been working with White Oaks, which is an independent community over in Manchester, with a pilot program to bring in case management. And so they alerted us to the fact that he was starting to have some dementia issues and wandering at night, and they weren't able to get a hold of the daughter-in-law. He eventually ended up in the hospital a few times with some issues, and the hospital called us to find out what they could do. We couldn't get a hold of the daughter-in-law at all, and so we ended up going to court to try to get a conservator for him, which we did. And then at that point, she showed up and said that she would take care of everything. And, of course, she hasn't and has now disappeared. There's a lot of people out there that are like that. And with the holidays coming, I would urge families, I would urge neighbors to just be aware of your neighborhood. Be aware of that person that's living by themselves that just doesn't seem to ever have anybody visiting them. This is a good time of year to be giving and thinking about bringing over a meal to that person that lives by themselves, maybe sitting down and just saying to them, how's it going, finding out more as to whether or not they have families involved with them. If they don't, maybe trying to let the social worker in that town know so that they can help these people. To families, I would say this. Be acutely aware when you're visiting your families as to what's going on with Grandma and Grandpa. This is a really good time of year to recognize when you go into their house, is the house really messy? Do you see medications everywhere? Does your mom and dad seem like they don't know much about how their day is organized? And you can do this without interrogating them. You can do this just with a conversation with them. Are their clothes dirty? Does the car have a lot of dents on it, and you know that your father's driving and you're concerned about that? You really need to start addressing this with your parents earlier than later. And I actually do this workshop called How to Talk to Your Parents without about those difficult things without the fear of getting grounded. And the reason I put this together is that I had a lot of assisted livings asking me, how can we talk to the kids about managing their families better? Because everyone seems to be afraid of their parents. I've gotten comments from kids saying to me, I don't really want to talk to my dad about not driving because he's going to get mad at me. Well, he may get mad at you, but you may end up saving a life by having that conversation and making sure that they are safe. Take a drive with them. Find out whether or not they know how to get back from the grocery store without you directing them. What's their hearing like? What's their eyesight like? This is a great opportunity, like I said, for families to really take a peek at what's going on and try to get some help in prior to there being a crisis. You know, our particular nursing practice deals with crises all the time, and they're normally crises that could have been prevented by families just recognizing ahead of time, yeah, you know, I knew something wasn't right with Mom, but she always seemed to kind of talk herself out of it. So that is my advice with the holiday coming. We're going to talk about this every week until the holidays are done with, because it is your opportunity to recognize the issues before there is a crisis. Again, we're going to be welcoming on our show Christopher Fey. He's a longtime entrepreneur. He has a company called BigBang Health Care, and the reason for that is he apparently, and he can tell his story, had a brother that in his 30s had a stroke, and he just wondered why that happened. He talks a lot about preventative care, which is a lot in the news lately about preventative care and managing your own health, participating with your physician. It's difficult to have a collaboration with your physician, unfortunately, when physicians are seeing 30 patients a day. So we as a society need to take charge of what we need and explain that to them ahead of time so that you can also be preventative about what's going on with you. In a few minutes, we're going to be taking a break, and then we will come back to Christopher Fey. So thank you very much for listening to Revolution Healthcare Radio.
Uh-oh, flu season again. Time to get a flu shot. You now have a choice in flu vaccines. You can ask for Flu Block.
It is the healthy individuals that carry and spread the flu. Every year, about 30,000 Americans will die as a result of the complications of influenza.
It's one of the reasons why I had an interest in it is that our population, that our service tends to manage our elderly. People were having to get a booster with the flu vaccine. What I liked about Flu Block is that the people last year in our group, the clients of ours that got the Flu Block vaccine, did not get a booster, and they did not get the flu. And the people that didn't get the Flu Block vaccine either got the flu in addition to getting the vaccine, or were told by their physicians that now we had to try to create a process for them to get a second vaccine.
The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Good morning, everybody. Welcome back to Revolution Healthcare Radio. I have to correct myself. You can tell that I haven't had my coffee yet. It's BigBang Health Care, not Big Blast Health Care. But maybe now I've given Chris an idea for another franchise or another idea. We do have Chris Fey on the telephone. We're welcoming him on. And again, he is a longtime healthcare entrepreneur. Mr. Fey is the founder of Healthcare USA and Health Ventures, U.S. Preventive Medicine. He's also a member of Wall Street Journal CEO Council, and presently he is the CEO of BigBang Health. Welcome, Chris.
Sharon, thank you very much for having me on your show this morning. I really appreciate it. It's glad to be here.
Well, I'm so glad we finally got you on. I know that there were issues with phones before, and I also have Fred with me this morning.
Hi, Chris. How are you?
Hello. How are you doing?
Good.
So I was talking to everybody about self-funded programs, which not a lot of people know about. I mean, I was aware of it because I do have colleagues of mine that their nursing practice or their care management practice is kind of wrapped around being a third party for self-funded programs. And I know they're becoming more popular, especially with the Obama care health plan that came forward and the cost of health care. So tell us a little bit about yourself as to why you even got involved in this, and then if you can go into what self-funded care is, that would be awesome.
Terrific. Well, thank you very much. And again, BigBang Health is a company that I've founded after decades of experiences in the health world, from the 80s, where I helped build HMOs across the United States as a part of the team. In the 90s, I built my own HMOs, fully licensed insurance companies in managed care. In the, as you mentioned earlier, and one of the things that got my attention, my 39-year-old brother-in-law was standing next to me and had a massive stroke. He was 39 and had a lot of previous symptoms about what might be leading up to this, but kind of blown off by the doctors, whatever, medical world. It was the holidays. Come back after Christmas. Well, the day after Christmas, he had a massive stroke, and he's been paralyzed ever since. On the right side, as you may see people who have that effect. And after that, I went and talked to, a top cardiologist and kind of ran those symptoms by him. And he said, had we been presented with this, we would have run some tests. We would have been able to intervene, with some different procedures. The odds are that he might not have had that stroke. That got me thinking about preventive medicine, and I went on to start a company, which is a nationwide population health management company called U.S. Preventive Medicine. But after I left there, and I kind of went back and put my thinking cap on, and I said, what's wrong? In fact, if you go to BigBangHealth.com, there's a 40-second video. It kind of goes back to the dinosaurs, Big Bang, and how we created this idea, and I'll explain the self-funded component in a minute. And it became obvious to me that if you look at what healthcare is, it's a disconnected, kind of disjointed, non-coordinated, and in many cases non-collaborative enterprise that consumes, I think, 18% of the GNP in this country, and it's growing. It's somewhere between, over $3 trillion now is spent on healthcare. And then if you get back into the, healthcare experience of what happens when I go to the doctor, they ask me some questions.
Everyone's looking at that experience now, because as with everything, healthcare tends to be driven by revenue. So now hospitals are being paid for the experience that they can extrapolate from their patients. And they're, again, not looking at data, not looking at outcomes. They're looking more at, let's make our hospital look like a hotel so we make everybody happy when they leave here. It's just a crazy, crazy setup.
Exactly. And, in fact, I'll give you some things that have just come out in the last few days about where the entire healthcare system has got to head. And if you look at what's happened with the advent of technology and the proliferation of wireless devices, fitness trackers, and, thousands of healthcare apps, it's kind of too much. You get up in the morning and you go about your day, and how much, information overload can you take? And you go into the hospital and the provider world, same thing's happening there, where people now are, feeding in all this different data and information. How do you pull all that together and utilize it and then deliver a better outcome? And when you're hearing the words value-based outcome, it's been a long time coming. The quality movement hit the United States in the 60s and 70s, and you saw that in cars and all kinds of things.
And yet we still have hospitals. I know in our state, 90% of the hospitals are going to be penalized for readmissions. So everything that they put together, all these communication tools, all the ACOs they put together, aren't working. They're still like dealing with their little world of not letting anyone else in, and they're going to manage it themselves. So you're right, outcomes aren't improving with all of this because it is too much. Everyone's coming in with a different plan.
Well, and the new big thing which in fact I maybe was early in on when I formed this company, U.S. Preventive Medicine, a long time ago, which was that prevention is a key part of it. There's some debate whether, what can you prevent or cannot prevent. But, as again, we move into the future, as you have your show in the coming years, and you talk again about more of the technologies and some of these nano things that are, going to be able to identify cancer risk, et cetera, and you can get in early on this. The question is, how do you pull all that information together and try to take better care of somebody who has a busy day? And how much, back to how much information overload, which gets back to, let me just share BigBang Health and what we decided to put together was, if you take a look at all of these pieces, you've got hospitals, you've got doctors, you've got lab, you've got pharmacy, you've got durable medical equipment, wheelchairs, you have home helpers, I think is the company you just mentioned.
Correct.
These are all part of the collaboration mix, and how do you actually bring them together into a, quote, company, a self-funded company, which is our niche, and then deliver better care coordination. And then our positioning line in the company is we put this together and said, if you put all these pieces together, we can actually deliver what we call more bang for the buck. We can give you more stuff, more interactions, more collaborations for the money than you might in a less connected world in another health plan that may not be doing what we're doing. So, it's communication, collaboration, the push to population health management. You mentioned this gentleman previously that, had some signs of dementia. And, there's early warning signs for that. There'll probably be, there's some diagnostic tests even that are getting into studies about how would you better predict that. One of the theory of prevention itself, which is a big part of BigBang Health, is how do you prevent things from starting in the first place? If you're going to get it, how do you identify it at the earliest possible point? And then next, how do you better manage that condition according to clinical guidelines? This is all information that you think your doctor is twirling around in his head, which he's got a lot of things going on, and then focusing on you as you move, from one care provider to possibly another, all of this coordination of information that would say, here's what you should do next. That's what you want to know as a patient. What do I do next? What are my options here? And give it to me as quickly and as accurately as possible according to the clinical guidelines of how do you prevent something, how do you identify it early if you might be getting something, and then how do you manage the condition of that person to a better medical outcome, which leads right back into readmissions. If everybody followed all the care guidance notifications across that continuum, that's one way to reduce admissions, because they don't know the red flags are going off when that person went home, that their blood pressure spiked, they're feeling dizzy, whatever the indications of that case would be, a lot of which is cardiovascular, spine, orthopedic, and cancer. That's kind of the three big conditions that are dealt with in hospitalizations.
Well, and I also think the other thing is, Chris, is that, as we have had physician practices bought by hospitals, and I know I spoke about this on an earlier show, they're now mandated to see 30 patients a day, and sometimes more than that. So as we're talking about collaborating, identifying, and access, which is really the three pillars that you and I look a lot at, for our particular practice, identifying is difficult because it's difficult to get in front of the doctor to even get an appointment to bring in the symptoms that are going on. And then when you are there, you have maybe a 4 to 5 minute window if you're lucky, because the physician's actually so busy documenting in the computer, they're not even looking at you. So, we need to also fix that piece of it, in that we have to be able to have someone we can get in front of that can help us, take care of whatever issues we have. A quick example of that is that, I ended up with high cholesterol. So I have a holistic physician who spends probably 20 minutes with me before we even get into taking my clothes off for her to actually examine me. And the time that she spends with me is talking about, so what's going on? What's going on in your life? How are things going? How's your stress level? Your cholesterol is this. And I was very apprehensive to go on a statin, having the knowledge base I did. So she and I together discussed my going on to an alternative, which is red yeast rice. It's a natural statin. Could I do that? And that's what I ended up doing. I know that going into a regular practice, that time is not going to happen. So, that's a big challenge for you guys as you're out there managing these companies that are self-funded. Do you get involved in that piece of it, or do you just take care of the issue at hand? Like for Deborah Alt, that I'm friends with, the company she works with has an administrator who is involved with the fund. So when one of the employees needs surgery, they then go to her, and they've already prepaid her for that piece of it, and say, okay, Mr. Smith is having surgery. She then does the research on what surgery, the best hospital to go to, the cost of that, and then helps them through the process. That person, they personally help them through the process of the surgery and afterwards. So is your company similar or different?
That's one of the pieces that we do. That's, it's case management. When somebody has an event or a condition that's going to lead to the entry into the system. Remember, 80+% of the healthcare costs are spent, by people that have chronic conditions. If you're healthy, you're not spending money. Even you may be paying and be complaining about what you're paying, but if you're not accessing the system, so you have this window of concentration that you need to apply, but it gets back to proper care guidance notifications. And one of the things that we did is we teamed up with a company that has built an application that connects in a HIPAA-compliant methodology your, quote, you and your care providers and the plan, so that if you think about Skype and you have a Skype app on your phone and it pops up and says you have a message, well, that message may be coming from the case manager that says, I see you just got diagnosed with the condition. Let's get involved with this and try to help navigate that information for you. And by the way, attached are the care guidance notifications for, hypocholesterolemia, with high cholesterol. So you'd say, wow, thank you very much. I didn't actually have to call and try to track down somebody. I got a nice note that said they're on the case, and they sent me the care guidance notifications of what to expect in the treatment of cholesterol. If you want, then on this app, you could invite your doctor, this great doctor that you just said, to come into your care, quote, let's call it feed, that would say, oh, I see, thanks, Sharon. I see you got the notification from the health plan. I see you got the care guidance notifications from NIH that talks about how to treat, cholesterol. And so it kind of removes a lot of the discoordination that happens because you got to try to talk to your doctor or you try to go to see him. But this mobile application, which is kind of our connector across these various entities that do different things, again, from pharmacy to lab to primary care to hospitals to now some of the, case management companies, et cetera. And that's really what we saw as missing. It's this, disconnected, care collaboration network that's out there that really is not able to communicate effectively because it still goes a lot back to fax and phone and email.
Which a lot of people
are not secure, non-HIPAA compliant.
Right.
Phone, I guess, is, whatever. But, if you're talking about sending your doc, an email or sending him a fax or sending him a text, those things are really not coming across in a HIPAA secure environment. But I did want to mention one thing, if I can just maybe interrupt your next thought there. What we're seeing with the hospitals today who have bought physician practices, this was done in the 90s. This is not something brand new.
Correct.
Hospitals went out and bought practices. What they found was what you just pointed out was you buy the practice from the doctor's now an employee, and then the employer comes in and quote the hospital and says, okay, you've got some production quotas here that you've got to meet. You got to see 30 people a day or 40. And, the average primary physician has, several thousand, anywhere from 2,000 to 5,000 patients that he's supposedly keeping track of, but it's really hard to do other than when you sit down and look at that person and that doctor and they're sitting at the computer the whole time you have the interview.
So, Chris, hold that thought. We're going to take a quick break, and I want to come back and expand on that because as you talk about these applications and who's going to manage those with the collaboration with the physicians, that's going to be an important piece of that. So you're listening to Revolution Healthcare Radio. We'll be back shortly after a break. Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We work with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
You now have a choice in flu vaccines. You can ask for Flu Block. No actual flu virus is used to make Flu Block. Flu Block protects against the flu. No gluten, no latex, no eggs, no antibiotics, or no formaldehyde. Flu Block is proven to provide broad protection against multiple strains of the flu. The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Welcome back, everybody. You're listening to Revolution Healthcare Radio. Our number again is 888-574-2444. 2723. We're talking to Chris Fey. So before the break, Chris, we were talking about what happened in the 90s where practices were bought, they continued to be bought, and now they're mandated to see a lot of patients. And what does that do now with the collaboration and preventative health issues that you were talking about? So carry on.
Yes, well, I will tell you what did happen in the 90s. Later in the 90s, is those hospitals divested themselves of those physician practices, which they went back independent. Now here we are. That happened in the late 90s and the early years of this century, and then and now they're back in there again. And part of this is because what they're trying to do is what we're talking about is to control this entire care collaboration, thinking if we own them, we install the electronic medical record, which is what the doctor is sitting there filling out, and that is for documentation of, what the, what conditions this person have, what's their, biometric information, what do we have, then make a judgment about what we think they have. That's the diagnosis, which is another key part of medicine, which is, do you have the right diagnosis? And if you have the wrong diagnosis, you might follow a care guideline that's improper, and this happens a lot in lower spine, back pain, which is hard to diagnose. I think 30-40% of lower back pain, if you have any listeners out there, it is 30-40% misdiagnosis in that, which leads you to not getting better, and in fact, it's spent a lot of money. But I think we're, again, back to what our care collaboration network, what we've put all the pieces together in one big tent. We decided let's call it something different. Let's not call it, Health Quality America or, Quality Health Plan. Let's call it something startling. Let's call it BigBang Health. We kind of, our video, again, on BigBangHealth.com tells you in 40 seconds, hey, we kind of went back to the beginning and said, if you could take a clean piece of paper and put all the pieces together, and then as I'll talk before we get off the show, and take this into the employer market, what's particularly called the self-funded employer market, where we can demonstrate better care coordination and a reduction in total claim costs, because ultimately, again, your viewers are responsible at some point for part of the claim cost. And it's this new high deductible plans, where the individual is responsible. Somebody was talking a minute ago about hip surgery, $50,000, and that really depends on what your care is, and you might have to pay the first $5,000, or high deductible plans are now being paid $10,000 is your responsibility. And as she said, you go to how do you figure out where you can get the best care for the lowest price? Because if that's your money, that's what you want.
So the companies that you
there's a lot of things going on.
The companies that you are involved in are really those smaller companies. It's not the company that's got 50,000, or is it?
Well, this company is just launching out. We're just quoting our business. We started this company about a year ago, and it's not easy to put together a national health plan, but we've been at this for over a year, and we're just now going through in this fall cycle of starting to quote business for 2016 and 17. So, but we're negotiating today with, and we sell BigBang Health through brokers who sell health insurance, who have clients. They have employer clients.
Yep.
And we're getting extremely positive feedback from some large regional brokers, multi-state brokers, as well as national brokers who are in 100 cities, basically selling health benefits to employers. And we're getting very positive feedback from this discussion that we're having right now.
So just walk me through then the process. I'm a company of 200 employees, and I'm looking to be, or 500 employees, whatever it might be. But, what is it that you would say to me to become a self-funded company?
Well, number one, we would say, what we've done with BigBang Health is to put together a one-stop shop, a one-brand offer to pull all the components of healthcare into a benefit offering that can deliver you better care, we believe, and lower cost. And the piece of this, which is what gets somebody's attention, what we're hearing from the brokers and individuals is that, hey, BigBang Health, that sounds cool, that sounds new, that sounds different. So we're getting a lot of attention because we're new and we're different. And then many of the pieces that we've just talked about before. But the next thing that would happen is an employer would say, okay, would you give us a price? Tell us what it's going to cost us. And what we do is we have to get some information, what their claims experience is. And this is the way health plans figure pricing anyway. But we do some different things to lower the cost. So you say, give us, how many people do you employ and what are their age and gender? That's really the information. And then what are the claim costs? So what's your claims experience been over the last numbers of years? And there's a new piece of this that I'm going to tell you about. A lot of people don't even understand this, but your health plan buys something called reinsurance. Mm-hmm. And that reinsurance is purchased in the event that there's a catastrophic claim over over $100,000. Somebody has a stroke, that's $500,000 to could be several $1 million in the treatment of that one case. So what you buy is stop loss insurance. Everybody out there doesn't know this, but part of what the money that you're paying, you're buying a reinsurance plan to pay for a potential catastrophic situation. And all employers do this. This is not new. What we would tell the employer next is we deploy something called reference-based pricing, which is a technology tool that actually, with this person the case manager who would be going for a surgery, et cetera, what we do is get in the middle of that conversation and bring the pricing down to what's more reasonable. If it's because charges vary all over the United States, and the charge is what you charge. Medicare is the floor reimbursement level where Medicare says we're going to pay X, and that's all Medicare pays. Mm-hmm. Well, everybody else who comes in that's not Medicare, they're paying more.
Correct.
Because they're supporting the people on Medicare. That's the way this financial mechanism works. So by employing what's called reference-based pricing, we go and sort of adjust those prices pegged off of a Medicare reimbursement. And what that does for an employer, that 200 life employer client, 200 employees, you can actually see a reduction in their claim cost of anywhere from 10 to 20, 25%. They'll spend less next year, could be as much as 10 to 25% less, just by changing the reimbursement. Not anything to do with the care and the coordination with the doctor. This is just the financial mechanism of healthcare. What that does, it triggers a reduction in stop-loss premium. This is kind of complicated, but it's just there's these couple of pieces. Healthcare is a financial mechanism to pay for sickness. Let's all accept that.
Right.
This is a mechanism that can actually lower the claim costs for the employer, triggering a 10 to 15% reduction in their stop-loss premium.
So are you actually negotiating with hospitals and physicians for the cost of like a hip replacement or abdominal surgery?
Dialysis, yes.
Fred actually had a question, I think.
Is that a process that the employee is actually involved in? Like when they come to the table and you have to get a major surgery done?
If you were going to get a major surgery, what you would be doing, and that's called a prior authorization. Something big and technical and complicated would be prior authorization.
Right.
With that prior authorization, communication back to us, either by the mobile app or a phone call or an email, that starts the process. Where do you live? Okay, what's the situation and communication to the doctor, to the member, and what is it that you need? And let's say you live in Rochester. The person says, I want to go to Mayo. And there's, another hospital that's equally as good and half the price. What happens that we do is we go in and in most cases, 95+% of all cases, they accept the lower reimbursement because they want the business. And that person is given the choice that if you go to hospital A, which is completely checked, it's just as good and famous, it's just doesn't have the Mayo Clinic brand, because part of this is your deductible, you'll spend a lot less of your own money with equal care if you just changed hospitals for you. That's a negotiation that's done by us to get that person to show them back to price transparency what the best pricing is, including quality.
Is that something unique to you guys?
In almost all cases, this reference-based price negotiation, because no hospital wants to lose money. They don't want to lose any patients because that's revenue to them.
Right.
So is that unique to BigBang Health that you guys are actually negotiating?
Well, this term I'm using, reference-based pricing, is not widely used in the United States. Typically, what a major health plan would do is They negotiate with the hospital and say, here's all the codes for all these conditions, and then let's negotiate a price. And then that's the price that goes into the computer. That's all automatic. And in many simple things, that just becomes part of that, automatic piece of it. But again, what we did in our, quote, network, where we've teamed up with a multi-plan, which you probably would know, but it's a network of about 600,000 physicians. That's our physician network. Same thing with, we have a dialysis network, hospital networks, and they're there in place, ready for you. In that, remember, 10%, 20% of the costs are being spent by people who have chronic conditions. Those are the people who are going to go on to experience hospital care. So you're narrowing down the group of people that you want to focus on and make sure they get the right care guidance notifications, the right communications, communicate with their through their mobile application, so you don't have all this back and forth phone calls.
So you're involved in a company that has mobile apps that someone's able to extrapolate information from the employees directly. And do you also have, that's a question, but in addition to that, do you also have the ability to go into a company and get information of the most, let's say a company has a huge diabetes issue. So part of what you do is education.
Correct, right. And the term we use, population health management. In fact, it's come out that this is like one of the. I'm going to be speaking at a conference of 65 health plans Tuesday and Wednesday in Orlando. And one of the big topics of conversation, of the 6 topics of conversation, is going to be this term called population health management, which is really back to this care continuum of prevention. Try to prevent it. How you do that? Well, you do that with, getting your correct screenings, not screenings that are incorrect, but the right screenings. Get some kind of risk factor profile to find out whether you maybe, have metabolic syndrome. You're not diabetic, but you're headed in that direction, and it's to have the bell go off in your head and say, you know what, I'm headed down a path that I may want to, do something different. And then we provide the information to help guide you to a better health outcome.
But, the people that are the most costly, Chris, and the ACOs are really the middleman between the hospitals and physicians who are dealing with population management. My sense is that when you have a major hospital or a major group of physicians dealing with a population, the ones that cost them the most money and are the ones that fall through the cracks are the ones who aren't going to self-educate, aren't going to, benefit from identifying and being proactive, and that's what's costing them the most money. Now, you're dealing with companies, so depending upon the company, you may be in front of the same people, depending upon their education level, their culture. You're still going to have a group that is high risk and may end up potentially costing that company a lot of money. So those particular people, like, how do you manage that? Like, that's the population that we tend to get involved in that are very high risk, and they need that one-on-one, which is what we do, that one-on-one where there's one person in charge, and we make sure from the time of the crisis through the crisis and onward, we're managing them in a way that it doesn't happen again. So, you're going to have those people, and what is the best way to manage them?
Well, I think what the RAND study that recently came out, I think last year,
yep,
and it talked about this whole population health management and what where you get a return on your investment, and that was called disease management. And a few years ago they kind of have different names for it, population health management, care management, etc. But it was actually the process of having nurse coaches and a collaboration platform for them to engage them individually, because everybody's an individual first. They become patients when you start to lump them all together.
Correct.
But everybody's not the same. But the RAND study showed that the most highest return on investment from things in the quote population health that are being thrown at people, thrown at companies, etc., is in this category of actually managing the people with chronic conditions. Because, if you remember the old days, it used to be, the doctor said you had something, and then he would either tell you what to do or, then you'd go to in the old days, you'd go to the internet. I'm saying, no, the really old days, you didn't have the internet, you'd go to the library.
And you actually did listen to your doctor in the old days, too.
Right.
Yeah.
But, typically they'd hand you a little handout from the drug company that would say, here's this, and go back, we'll book you an appointment in, 6 weeks or 2 months. And it was very it wasn't as, quote, it is getting better because now we have technology that's coming in here to better identify risk, which we have in our company, and we're not the only one that has that. But, we tried to just say, let's take all the pieces out there and put them under a one-stop shop, one brand offer, call it BigBang Health, promises deliver more bang for the buck. Let's take that to the market and then put all the pieces in I call it a tent. Let's call it in the tent, you have the three-ring circus. We have to be able to pay claims. We have to be able to do prior authorizations. We have to be able to communicate to members. I mean, that's kind of you got to have. Another company may say they want to, have home health brought in. They might want hospice brought in. Outside of the you got to have, pharmacy, hospital, physician, communications with that member, the things that most people do experience. And then now you have in our quote tent where we're adding, all kinds of companies are coming to us that are niche companies with the one offering kind of thing, like your home helpers company you just spoke about. That might be a company we want to put in our tent where somebody in the markets they're in, where we could team up with them and use them in that market to supply that. So
nationally you're starting to collaborate, which is huge. I mean, I've said for such a long time that you can't stay in this little fortress, which there's lots of articles about the fortress and the frontier, that you need to collaborate with the other people. I think Fred had a question for you.
Yeah, I was curious about, you mentioned RAND Corporation. There was another study about wellness programs that came out that they said that they were really not that effective. There seems to be a lot of across the board. Some say they are effective, some not. It seems like your whole theme throughout your career has been preventative medicine, and the wellness programs are something that will obviously keep people from getting sick. Now, what are you guys doing to increase participation levels in the wellness program that you provide with BigBang Health?
Yeah, well, that's a very good point. And there's not far from you, there's a guy, Al Lewis, who has publishes a blog and posts and everything else on this subject. And he probably, if you've seen this on LinkedIn, where there have been studies that have come out and suggest that, in fact, those programs are not effective on the wellness side. What the RAND Corporation study said essentially was that in wellness, if you look at this, prevent things from happening, keep people well, and then if they move into this quote, cross the border where they become, chronic condition, need care management, that half of it has been proven to work. The generic, quote, wellness and vendors, and what they call it in that study was that, are they using the USPTF, which is the U.S. Preventive Task Force? It's the government's, it's a government deal, but it's some of the best doctors in the country that have said, let's look at all the studies and tell me whether somebody should be doing a PSA test and a wellness vendor screening at a company, whatever. And the USPTF would say no. And there are some vendors that do that test, and it's not recommended after all the review of the information, and that's one controversial test in particular. And then in looking at some of the way the studies have been done and the participants versus non-participants, there is a lot of, I'd say, confusion about what works and what doesn't work. And the piece of that on the wellness side, now there's something called now the GE Validation Institute, which has gone in and now Lewis is behind this, is, actually study companies who are making claims and then study their claims to make sure their claims are validated. So there's only a few companies now that have come through the GE or the Intel GE Care Innovations Institute that have this, quote, certification. The company that we use to provide I call it the wellness and prevention and the chronic condition management, the nurse coaches, has received that validation. So
So we have about 30 seconds before we're taking another break, Chris. When we come back, let's continue to talk about wellness programs, because I do think that it's really tough to kind of get people to understand what they need to do proactively. You know, we're all guilty of that, and we'll expand on that. Again, our number here is 1-888-574-2723. We're talking to Chris Fey, and we'll be back in a few minutes.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
You now have a choice in flu vaccines. You can ask for Flublok. No actual flu virus is used to make Flublok. Flublok protects against the flu. No gluten, no latex, no eggs, no antibiotics, or no formaldehyde. Flublok is proven to provide broad protection against multiple strains of the flu. The next time you get a flu shot, ask for Flublok, the pure choice, because you have a choice in flu vaccines.
Welcome back, everybody. This is Revolution Healthcare Radio. We have the pleasure of talking to Chris Fey, who is the CEO of BigBang Health. I love that dinosaur you have on your webpage, Chris. I bet that was quite the discussion when you guys decided to come up with this.
Well, it certainly turned a few heads, but I, from a, let's call this a branding side of it. The first thing to get, and engagement is a key word here. When you talk about how do you get people, populations of people caring about their health, paying attention to information. It's called engagement. We decided to use that theme by pretty much calling the, some health plans may be stuck in the dinosaur age. And, that's what that video is all about. And we decided to take some really smart people, go back to the very beginning. And we're talking about some great subjects here. Obviously, we're not going to be able to, dissect the entire $3.5 trillion healthcare industry on this call, but you certainly are very intuitive about some of the most key points that are going on in healthcare right now.
Correct. And we'll certainly have you back on our show. We have about 6 or 8 minutes left here. So there are other companies that do what you do. I had first gotten introduced to self-funded programs a few years back with a broker in Connecticut, and he was interested in what we were doing, and it would have been a new approach, and it didn't end up working out. I didn't have a lot of education about the process. There wasn't a lot of discussion or that we seemed to could get through as to exactly how they could utilize our services. But how does this benefit the employee? Like, right now, you've got Blue Cross, United Healthcare, Connecticut, all those big companies who are really saying they're doing what you're doing. We're providing education, our expectation. Like my husband has Blue Cross. He needs to go see his doctor every 3 months because he's diabetic. Then that doctor is required to do an A1C on him because the doctor won't get paid unless he does that. My husband would be punished if he didn't end up staying on track with what his requirement is. So, what would be the difference, I guess, between the two, and what kind of makes your company stand out versus the others? There are other self-funded companies that do similar.
Yes, well, very good point. And I think that there are probably over 1,000 health plans in the United States. So we never did say we created a new category. What we've done is we've tried to take a different approach. But no, you're absolutely right. And again, the Blue Cross is great companies, United, Aetna, et cetera. One of the things that you have with a giant company like that sometimes, I'm not naming them in particular, but let's just call them some health plans, is, and I will use, and my wife, I'll give you a perfect example where she's actually gone through and seen many specialists over the course of the last few months, and we have a big national health plan as a company, and any one of these visits, and I've gone inside and talked to the doctors personally about BigBang Health.
Yep.
As part of the visit, I said, hey, I got to tell you about what I'm doing, and I want to get your impression as a doctor. And what the doctors immediately say to me is, I hate, and they would name a company. And they say, I also really hate X. And they just came out with a list of the most hated health plans, and they're some of the biggest ones in the country.
Right.
And a lot of that is just simply because all this months of process my wife went through, she's never, every one of which should have triggered a phone call, should have triggered some communication between the plan and the member who was going through some, the specialists are more expensive than the non-specialists, not a peep. And one thing that I will tell you, and this is something to remember for all the people on the phone, or listening in today on the radio, why is it that a woman can buy a 100 pair of shoes at Zappos and talk to somebody in a customer service line for half an hour, and you can't get anybody in your health plan on the phone? Why?
And I agree with you. So we have about a minute and a half left. So what you're really talking about, which is what I talk about all the time, is relationships. Your company is relationship based, so someone is going to get that phone call. And you're right, no one's ever called my husband, who's almost 70, to say, how are you doing? How's your diabetes? Do you live by yourself?
Or if he had this mobile app from BigBang Health, and he got a Skype, and he didn't have to try to get somebody and go through the decision tree and the 5 minutes, 10 minutes on the call. If you got an app that's and he just tapped his phone and said, how are you doing today? Is there anything I can do to help you? He sends back and says, I think it all is good. My A1C was terrific. I'm feeling good. I'm following that. Super. Thank you. We're done.
And I think that's huge. And when you look at the population, you might have those statistics about the population of people using cell phones. It's the people in their 50s and their 60s, the ones that need all of this help to begin with. Chris, we're going to be having to end our show. I so thank you very much. We definitely are going to have you back. I can't wait to meet you. I think you're a wealth of information. When anyone starts a business based on passion, or something personal, I think that it makes all the difference in the world. And you're absolutely right. Relationship-based companies are the ones that are going to be the companies of the future. So thank you for calling in, and to all of our listeners, thank you for listening to Revolution Healthcare Radio. We will see you next week, and I believe next week we have Michelle Siegel, who is from the Department of Consumer Protection, to talk about marijuana, legal marijuana. Thank you, and have a great week, everybody.
Thank you so much.
Coming soon, the Revolution Healthcare Podcast. The people who never talk and the stories that don't exist. The podcast is a more intimate, in-depth examination of the personal challenges caused by healthcare. The focus is on the human aspect of healthcare, from patients and families to doctors and nurses. They all have a story that needs to be heard. The Revolution Healthcare Podcast is available early January 2016. Thank you for listening to Revolution Healthcare Radio. Want to learn more about the show? Visit revolutionhealthcareradio.com. You can also access old shows, learn more about our guests, and contact us with your questions. Revolution Healthcare Radio, brought to you by Home Helpers of Connecticut and Protein Sciences, the creators of FluBlock.
Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com. At homehelpershomecare.com. At homehelpershomecare.com. At homehelpershomecare.com. At homehelpershomecare.com. At homehelpershomecare.com. At homehelpershomecare.com.